The Australian Medical Association is calling on pregnant women, parents and caregivers to ensure that they are vaccinated against whooping cough. This is all amid a concerning surge in cases right across the country. Well, Australia is currently experiencing its most significant and long-lasting outbreak in decades. More than 57,000 cases were reported in 2024 alone, the highest annual total since 1991.
Medical professionals say free whooping cough vaccines are available to all pregnant women, and parents and carers should ensure children receive their vaccinations on time. Well, let's bring in AMA President Dr. Danielle McMullen, who joins us now live. Hi there, Danielle. Is it unusual at this time of the year to have a spike in whooping cough?
Unlike flu, whooping cough isn't as much of a seasonal illness. We do tend to see outbreaks every 4 or 5 years, so that part was expected, but this one, as you said, has been longer lasting and much bigger than we've seen since the early 90s. And so we really do need to try and get on top of this whooping cough or pertussis outbreak, and vaccination remains our best way to do so.
OK, who's most vulnerable?
So whooping cough can affect anyone, and it gives you a long-lasting and irritating cough, but it's most risky for the youngest in our community, for little babies, where it really can be a life-threatening illness. Our best protection against that is vaccinating pregnant women, because actually by doing that we give the unborn baby some antibodies that protect them until they can get their own vaccines. So pregnant women, but also grandparents, parents, carers who are wrapping around that baby and seeing them early in their life should be up to date with their vaccines, which means a booster sometime in the past 10 years.
As you say, it is highly infectious, but some of the symptoms people might mistake for a cold or flu. So what's the particular symptoms that we should look out for?
But really, it often presents as what we call it the 90-day cough. It's a cough that just goes on and on and on. And so if you've had symptoms that just aren't budging, head in and see your GP. And likewise, often if there's a case at a school or a daycare centre, there'll be alerts out to families. So obviously, if you've had one of those and your kids are sick, pop on in and see us at the GP, and we'll make sure that you're aware of what's happening and that we can protect the community as well as your family.
What are vaccination rates like at the moment?
Sadly, across a lot of our vaccination rates, we're slipping, and that's both in our childhood and our adult immunisation rates, and that's not something we should be proud of. We're below the 95% that we need with whooping cough to get that herd immunity, and so really important that we get our kids along for all their routine immunisations, and then target like this one where we need to for pregnant women and carers of young children.
Why do you think it's happening? Why do you think people are forgetting or showing reluctance?
Look, I think it's a combination of things. There is, of course, a bunch of misinformation and floating around on social media that's getting people unnecessarily concerned, but also people were a bit sick and tired of vaccines through the pandemic, but we're well and truly clear of that level of vaccination now. And I think people struggle to take the time off of work or school, but we do need a whole community effort for vaccinations, and so really important to make that time, go in and have a conversation with your GP if you've got questions, and we need to protect the health of all Australians.